Swayam Prabha. Digital India. Educated India.
Good day to you. I am Dr. Gaurav Agnihotri, and today I am going to give a talk on the gross anatomy of the human heart. The human heart is a structure which has fascinated researchers and also medical students since long. Now, heart disease actually accounts for 25% of mortality, be it men or women. So, heart disease is a significant cause of mortality in human beings. Heart disease may manifest as congenital heart disease, or it may manifest as myocardial infarction or angina, in which there is a compromise of the blood supply of the heart. Heart disease may also manifest as valvular stenosis, or in many cases the heart may not function properly, what is referred to as heart failure. So today we are going to discuss the anatomical aspects vis-a-vis the human heart. Now, my teacher used to say, if you are to describe the morphology of the heart, always remember that the people at the highest positions, the people at apex, they require bail. By bail, he meant B-A-I-L. B stands for base of the heart, A stands for anterior surface of the heart, I stands for inferior surface of the heart, and L stands for left surface of the heart. He also said, whenever you are to describe the borders of the heart, imagine a square. That way you will never forget. So, actually the heart is a quadrangular structure. So, the heart has got an upper border, lower border, right border and left border. Again I reiterate, for the convenience of the viewers, heart has got an apex and base. That means the heart has got an apex, base, anterior surface, inferior surface and left surface, and the heart has got four borders: right border, left border, upper border and lower border. The upper border may be called superior border and the lower border may be called inferior border. Now, during school, students are often told that the heart lies on the left side. This is partly true because 2/3 of the heart lies to the left of the midline and 1/3 of the heart lies to the right of the midline. So, if I put my right palm to form the lower or the inferior support of the heart, then the tips of my right palm, right fingers, they represent the position of the apex of the heart. Apex of the heart lies towards the left side, just inside the mid-clavicular line. So, apex of the heart lies just inside the mid-clavicular line, and my right palm is representing the inferior support to the heart. So, now if I put my left fist on top, this indicates the position of the heart. My left fist is representing the heart with two-thirds of it lying to the left of the midline and 1/3 of it lying to the right of the midline, and the tips of my fingers, they are representing the apex of the heart. So, what you see in the front of my left is the front of my left fist, that is the anterior surface of the heart, and my left thumb is representing the right border of the heart. Again, if you see, this is the inferior support of the heart, but the fingertips are representing the apex of the heart. Then this left fist is the position of the heart with 2/3 of it lying towards the left of the midline and 1/3 of it lying towards the right of the midline. What you see in front of my left is the front of my left fist, which represents the anterior surface of the heart. My left thumb is representing the right border of the heart, and the tips of my right finger, they are representing the position of the apex of the heart. So, once again I am going to repeat the borders and surface of the heart because they are vital to have an idea and understanding of the morphology of the human heart. Now, the heart has got an apex which is directed downwards and to the left. I told you the apex lies in the left fifth intercostal space in the mid-clavicular line. We can say just inside the mid-clavicular line. Now, how are the atria and the ventricles separated from each other? That is also another important aspect vis-a-vis the morphology of the heart. Again, the atria comprise of the upper portion of the heart, while the ventricles, they comprise the lower portion of the heart. So, if I keep my two fists together, my left fist is now representing the atria and my right fist is representing the ventricles. So, there is a demarcation between the two, that is called the atrioventricular groove. So, that separates the atria above from the ventricles below. And again, the atria are separated from each other by the interatrial grooves, while the ventricles are separated by the interventricular grooves. If you look at the figure in the slide here, it is showing you the quadrangular heart and the great vessels of the heart. F is the superior vena cava, E is the inferior vena cava, D is the pulmonary trunk. We see the right atrium, we see the right ventricle, and in between the right atrium and right ventricle, we see the right anterior atrioventricular groove, which is a circular groove. And also we see on the front of the heart an anterior interventricular groove marked by B in the figure, that is separating the right ventricle from the left ventricle. If we go to the posterior aspect of the heart, then again we see that same atrioventricular groove separating the left atrium from the right and left ventricles, and the right and left ventricles are separated by C, which is the posterior interventricular groove. On the posterior aspect of the heart, above we see the left atrium in which the 4 pulmonary veins are entering, marked by I and H. Once again, coming back to the gross morphology of the heart, the anterior surface of the heart lies in front. So, this is the anterior surface of the heart, and then the base of the heart lies posteriorly. The base of the heart is the one which is lying in relation to the thoracic vertebrae 5 to 8. Base of the heart is the posterior surface of the heart. If we talk about the borders of the heart, the upper border is formed by the right atrium and the left atrium. The right border of the heart is formed in its entirety by the right atrium. This is a very important question which is asked in the examinations. Name the structure forming the right border of the heart, and the answer of the students should be the right border of the heart is formed in its entirety by the right atrium. The inferior border of the heart is formed by the right ventricle and the left ventricle, and we can see in this figure and try to understand that the inferior border is formed in majority by the right ventricle, while a small part is formed by the left ventricle. We also see here in the figure the left border of the heart, which is formed by the left ventricle, and it is formed by the left ventricle below and a small part of the left auricle above. So, this is the left border of the heart. Students should always remember that the left border and the left surface of the heart are formed by left ventricle below and a small part of the left auricle above. In this figure, we can also appreciate the anterior surface of the heart and the constituents of the anterior surface of the heart. We can make out the right atrium, the right ventricle, the left ventricle, and the left auricle, which are making up the anterior or sternocostal surface of the heart. Now, most of the anterior surface is covered by lungs, but the part that lies behind the cardiac notch of the left lung is uncovered. So, the left lung has got a notch, and that notch is in relation to the heart, so it is called the cardiac notch. On the left side is uncovered by the lungs, that is referred to as area of superficial cardiac dullness, because when we do percussion here, when we tap on this side, because lungs are not present, this particular part is dull on percussion. because the lungs contain air, and wherever there will be air, there will be resonance, there will be a sound. So, this area is referred to as area of superficial cardiac dullness. Now, inferior surface of the heart, it rests on the central tendon of the diaphragm, and as one can make out in this figure, it is formed mainly by the left ventricle and a small part of the right ventricle. The left surface, as I mentioned before, along with the left border, is formed mainly by the left ventricle, and in the upper part a small part of the left auricle. Now, the heart has got a fibrous basis. This is referred to as the fibrous skeleton of the heart. Thing is that the fibrous rings surrounding the atrioventricular and arterial orifices, they, along with adjoining masses of fibrous tissue, comprise the fibrous skeleton of the heart. This provides attachment to cardiac muscle and keeps the cardiac valves competent. So, always remember, the heart has a fibrous basis. Now, again we see here the anterior or sternocostal surface of the human heart. The anterior surface, I repeat once again, is formed by the right atrium, right ventricle, left ventricle and left auricle. So, we do not say that the anterior surface is formed by left atrium, because the left atrium is lying posteriorly. The right atrioventricular groove is almost vertical and lodges the right coronary artery and small cardiac vein. So, here we can see on the right side there is an atrioventricular groove marked by A. So, in it the red structure is the right coronary artery and the blue structure is the small cardiac vein. Along the right border, a shallow vertical groove passes from superior vena cava above to inferior vena cava below, called the sulcus terminalis. It is produced by an internal muscular ridge called the crista terminalis. Upper part of sulcus terminalis contains SA node, that is the sinoatrial node, which acts as pacemaker of the heart. So, the pacemaker of the heart lies along a vertical groove in relation to the right border of the heart, passing from superior vena cava to inferior vena cava. Now, this is a figure showing the tributaries or inlets of the right atrium. Here we can make out the superior vena cava, which is shown by capital C. We can make out the inferior vena cava, which is shown by capital D. We can make out the coronary sinus, which is shown by F, the opening of the coronary sinus, and then we can make out the opening of the inferior vena cava, which is demarcated by E, and then venae caudes minimi or Thebasian vessels. What are these? These are multiple veins which open in all the four chambers of the heart, and so they also open into the right atrium of the heart. Now, the interior of right atrium is classically described under three subdivisions: the smooth posterior part, the rough anterior part or the pectinate part, and the septal wall. So, here in this particular figure we are seeing the rough anterior part. B is showing the crista terminalis, from which muscular ridges like the teeth of a comb represented by A in the figure, they are passing towards the atrioventricular valve. But since this is a cut section, so the right atrium has been opened up. The direction that one has to comprehend that the tooth-like projections are actually going towards the atrioventricular valve, but because the heart is opened, so they are being shown in this figure on the left hand side. So, A is the musculi pectinati, B is the crista terminalis, and both A and B represent the rough anterior part. Now, into the smooth posterior part, superior vena cava opens at the upper end, inferior vena cava opens at the lower end. Superior vena cava is marked by C in the figure and inferior vena cava is marked by D. The opening of the inferior vena cava is guarded by a rudimentary valve of inferior vena cava or eustachian valve. Now, this eustachian valve is shown by H in the figure, and this eustachian valve during fetal life, it directs the inferior vena cava blood into the left atrium through the foramen ovale. Now, F shows the opening of the coronary sinus in the smooth posterior part, and G is the valve of the coronary sinus. The opening of the coronary sinus lies between the septal leaflet of tricuspid valve and the opening of the inferior vena cava. So, the opening of the coronary sinus is marked by F in the figure. Venae caudalis minimi, as I mentioned before, are numerous small veins present in walls of all the 4 chambers of the heart. An intravenous tubercle of lower has also been described in literature. It is a very small projection, scarcely visible on the posterior wall of atrium, just below the opening of superior vena cava. In embryonic life, it directs superior vena cava blood to the right ventricle. So, going further now, we go to the septal wall. The septal wall presents an opening which is represented by I in the figure, that represents the fossa ovalis. Now, this is the site for the foramen ovale. In the embryo, the deoxygenated blood passes from right atrium to the right ventricle, and then through this fossa ovalis, it passes from the right ventricle into the left atrium. The margins of the fossa ovalis are prominent, but they are deficient inferiorly, and these margins are referred to as the annulus fossa ovalis. Another important structure we see in relation to the septal part is the triangle of Koch. So, that is represented by a small t in the figure. The boundaries of the triangle of Koch are tendon of Todaro, septal leaflet of tricuspid valve, and orifice of coronary sinus. The triangle of Koch is occupied by the AV node. This is a very important question in the multiple choice examinations, that triangle of Koch is occupied by which structure? It is occupied by the atrioventricular node. Now, this is a figure which is showing the interatrial septum formation, and on the extreme right we see the patent foramen ovale. So, during development of the interatrial septum, there is a septum primum which comes down from the roof to the AV cushions, and suppose it does not meet the AV cushions, then the gap is left as shown by the figure on the left, that is called the septum primum defect. So, in the central figure we are showing you the septum secundum defect. If the septum secundum develops an opening in it, then that is shown in the middle figure, while the figure on the right side is showing the patent foramen ovale. So, after the pulmonary circulation is established at birth, the pressure in the left atrium becomes higher, and due to this higher pressure, then the foramen ovale gets closed. So, the figure on the extreme right is showing the patent foramen ovale, while the figure on the extreme left is showing the septum primum defect, while the central figure is showing the septum secundum defect. So, this is the figure showing the interior of the right atrium. Again, it is very important to understand the morphology of the interior of the right atrium. Externally, the right ventricle has got two surfaces, anterior and inferior, while the interior has got two parts, inflowing part which is rough, and it is rough due to the presence of muscular ridges which are called trabeculae carneae. So, G is showing the trabeculae carneae, and the outflowing part or the infundibulum is smooth. It forms the upper conical part of the right ventricle, which gives rise to the pulmonary trunk, that is shown by I in the figure. A, B and C in the figure are showing the cusps of the tricuspid valve. They are the anterior cusp A, B is the posterior cusp, and C is the septal cusp, while D, E and F are showing the papillary muscles or the trabeculae carneae. So, D is the anterior papillary muscle, E is the posterior papillary muscle, and F is the septal papillary muscles. These muscular ridges or trabeculae carneae are actually of three types: ridges which are fixed elevations, bridges which are supported on the two sides, and pillars which are the papillary muscles. So, D is the anterior papillary muscle, E is the posterior papillary muscle, and F represents the septal papillary muscle. Now, trabeculae carneae are attached on one side. If I talk out of the trabeculae carneae, if I talk of the papillary muscles, now papillary muscles are attached on one side to the ventricular valve, and on the other side they are attached to the contiguous sides of the cusps as shown in the figure. So, C here represents the attachment to the ventricular wall, while on the other side we can see the chordae tendinae which is getting attached to the cusps of the tricuspid wall. So, right ventricle has got another very interesting feature, that is the septomarginal trabecula or the moderator band. So, one can see the septomarginal trabecula here, a muscular band extending from the ventricular septum to the base of anterior papillary muscle. So, this is also called the moderator band. Now, this is showing you the interventricular septum. The interventricular septum has got two parts. The upper part is thin and the lower part is thick. The upper part, which is thin, is separating not only the two ventricles but also the right atrium from the left ventricle. So, the lower part is thick. Now, in case the upper part is deficient, that leads to a patent interventricular septum, what is referred to as the interventricular septal defect, or a defect in the interventricular septum. So, if the upper part of the interventricular septum is deficient, this is called ventricular septal defect, and this in fact is the most common congenital anomaly of the human heart. Left atrium is a quadrangular chamber situated posteriorly. Greater part of the interior is smooth walled. Musculi pectinate are present only in the auricle, where they form a reticulum. The septal wall shows the fossa lunata corresponding to the fossa ovalis. In addition to the 4 pulmonary veins, tributaries include a few venae cordis minimi. Left ventricle externally has got 3 surfaces, anterior, inferior and left. The interior is again divisible into 2 parts. Lower rough part, like the right ventricle, has got trabeculae carneae, and the upper part is called the aortic vestibule, which gives origin to the ascending aorta. There are 2 well developed papillary muscles here, anterior and posterior. The interior shows 2 orifices, mitral orifice and aortic orifice. The cavity of the left ventricle is circular in cross section. Now, there are also semilunar valves present in relation to the vessels, but here there is no fibrous ring in contrast to the bicuspid and the tricuspid valves. The free margin of each cusp contains a central fibrous nodule shown by A in the figure, from each side of which thin smooth margin, the lonule, extends to the base of the cusp. This is shown by B in the figure. Now, the coronary arteries, they arise from the anterior and left posterior aortic sinuses. And what are aortic sinuses? Just opposite to cusp vessel walls are slightly dilated regions which form the aortic and pulmonary sinuses. So, there are various congenital anomalies of the heart. On the left side, we see a patent ductus arteriosus. So, the green arrow in the figure on the left is showing the circulation of blood in the fetus. The deoxygenated blood enters from right atrium to right ventricle, and then from the pulmonary trunk it passes through the patent ductus arteriosus into the aorta. So, this patent ductus arteriosus may be present, and after birth it is obliterated to form a remnant which is referred to as ligamentum arteriosus. The 2 figures on the right side, they are showing the coarctation of aorta. Coarctation is the narrowing of the wall of the aorta. So, this coarctation may be preductal or it may be postductal. So, the figure on the right is showing the coarctation of aorta which is postductal. So, here we see that the ductus arteriosus is obliterated. This will manifest as enlarged intercostal vessels due to collateral circulation. So, once again, if I highlight the salient features of the gross anatomy of the human heart, the heart has got 4 chambers, it has got 4 borders. The right border of the heart is formed by right atrium. The left border and the left surface of the heart, they are formed by the left auricle above and the left ventricle below. The anterior surface of the heart is formed by right atrium, right ventricle, left ventricle, and not the left atrium because that lies posteriorly, but the left auricle. And the right border of the heart once again is formed by the right atrium. The inferior border is formed by the right ventricle and the left ventricle. The apex is formed only by the left ventricle. So, these are the salient features one has to keep in mind to comprehend the gross anatomy of the human heart. A detailed knowledge of the gross anatomy of the human heart is vital and imperative to understand the clinical manifestations and provide adequate and proper treatment. So, one must have a comprehensive idea regarding the gross anatomy of the human heart. Till the next time I see you, bye from me now. This is Dr. Gaurav signing off. Thank you, bye bye and namaste.